Reports on physical violence and abuse can be hard to bear, yet are vital in shedding light on the phenomenon. Violence against women increased worldwide during the pandemic. One country where the incidence rose particularly high is Kenya. Also coming up on DW's COVID-19 special, an Argentinian nurse is fighting for better wages. Since few other occupations have worked so hard during the pandemic, she says that nurses deserve a raise. But first we go to Uganda, which saw an Ebola outbreak in September. The government imposed travel restrictions and nighttime curfews, just like it did with the outbreak of the coronavirus. Now, the Health Ministry reports that the last known Ebola patient could be released from hospital. Julius Mugambwa reports.
Staff at this hospital in the city of Mubenda are hoping Uganda has now overcome its latest outbreak of the Ebola virus. Medical student Hudson Kunza was part of a team of people assigned to operate on a patient here in September.
He had a gut perforation that needed a surgical team to work on them. So being the medical intern on the emergency department, I was handed over to this patient. This patient was handed over to me, and I had to prepare this patient so that we can operate on the patient. But we didn't know that the patient is probably infected with the Ebola virus.
The patient died and was later confirmed as the first Ebola case in Uganda's latest outbreak. Hudson Kunza and the 6-person medical team also became infected with the virus. Kunza became seriously ill.
There was that moment like I really felt like death is coming. When I started feeling that you're there is no place you feel comfortable in. And when my friend, my colleague that I was with in the same room died, and I was like, okay, Hudson, you're going to die.
To contain the outbreak, the government imposed travel restrictions and a nightly curfew. But still, cases emerged in other parts of the country. It was the so-called Sudan strain, for which there is currently no approved vaccine. 40 to 60% of patients die. A total of 142 infections were registered, partly because few took the illness seriously.
Some people were not believing that there's actually Ebola happening, until we started having numbers rise, people dying, until we instituted a restriction movement, which we call a lockdown in 20 districts. But still, some people can't believe that it's a known disease. So the same challenges have persisted from COVID-19 to COVID to Ebola.
Cases of Ebola also emerged in the capital Kampala, home to 3 million people. Contact tracing is difficult in such a crowded city. The World Health Organization says a country needs to go 42 days without a new case to be deemed Ebola-free. That's twice the maximum incubation period for the virus. After surviving the deadly virus, Hudson Kunza hopes to finish up his medical training as soon as possible and start working as a doctor.
As a doctor in my profession, I really understand, and at the same time as a patient, I got a lesson of having to understand a patient from a point of view that sometimes it's not about giving drugs. You come to the patient and you give them drugs. At the moment I was sick, I only needed someone to talk to me, encourage me to feed, encourage me to drink something. So when I got healed and I got better, when I thanked the doctor who treated me, he actually told me, no, don't thank me, you go back and do what I've done for you.
Uganda is now due to start trialling 3 test vaccines against the Sudan strain, prioritising medical workers and contact persons, all in the hope of bolstering Uganda's fight against Ebola in the future.
No country has experienced a sharper rise in violence against women during the pandemic as Kenya. That's according to a UN study. Our reporter Beryl Asian tells the story of a woman who suffered a brutal sexual attack.
In the midst of the pandemic in August 2021, Marianne, not her real name, was on her way home after a long and unprofitable day of work. She earns a living selling knickknacks and doing people's laundry. A man approached her near her home. He asked if she would come by the next day and wash his clothes. It was already dark, but he asked her to follow him so that she could see where he lived.
I followed him and we got to the 4th floor of the building where he lived. When we got there, his door was still open. He pushed me inside and I fell onto a mattress. Then he closed the door, took off his clothes and started beating me while he was naked. He beat me and told me to keep quiet. He said that he had killed Susie and Sarah in that house and that I should be quiet and let him do what he wanted. After beating me, he began to rape me. When I screamed, he twisted my arm. He kept raping me until the next morning.
Cases of sexual violence rose sharply during the COVID-19 pandemic. Marianne was just one of many victims in Kenya. When she was 16 years old, Njeri Mikwe was physically abused by her ex-husband. Fearing for her life, she ultimately left him. Doing so was anything but easy. In order to help other women in similar situations, she founded the organization Usikimwe, Swahili for Don't Be Quiet. She has now rescued more than 450 women and girls. They receive temporary shelter and free food and hygiene products. The organization was flooded with calls and emails during the pandemic.
Days a year I did not sleep was 2020 because I literally used to just rescue people, like going to their houses, get these children, going to homes, get these women, and it was, I think, 2020 for me feels like a year that was a lot, but we handled it and we got the grace to do it, and that is even how now we even became a physical organization. We moved from being online to having an office to even the growth that you see today.
Njeri Mikwe has received many awards for her commitment, including the Defender of Human Rights Prize. Cases of sexual violence have not gone down. Njeri Mikwe hopes that more and more people like Marianne will speak out.
The people working in Usikimwe have really helped me. They also helped me get a lawyer. My heart is now at peace. And since I met them, I no longer feel stigmatized. When I come here, I feel like I'm visiting my sisters or my parents.
Marianne is lucky to have met Njeri Mikwe and had the chance to speak out. Too many women still suffer in silence.
Nurses in Argentina are demanding a pay rise, and they're doing so in soccer jerseys. Our reporter Alejandro Rebosio found out more about what's driving their fight.
Carolina Cáceres is a nurse. She worked throughout 2020 before COVID vaccines became available.
The
hardest part was leaving my sons at home alone so I could go to work. As nurses, we played a key role in the healthcare system. We were working more than ever.
Cáceres says that nurses took on around 80% of patient care.
In general, the risk of an infection is an occupational hazard. We're as well prepared for that as we can be. But in a pandemic, we have to think about our families too.
Cáceres worked in an isolation ward set up at the Tornu Hospital in Buenos Aires.
We watched one patient after another die. It wasn't easy.
She says that nurses were inadequately protected.
I went to court to demand PPE. The government manipulated protocols saying, for example, that a certain mask was not necessary to perform a certain activity.
Diego Dominguez is Cáceres' boss.
We went through a lot together. Once when a patient collapsed, we ran over to help him without thinking about our own safety.
Many of their colleagues had severe cases themselves.
There were nurses working in the isolation ward who came down with COVID and to this day have major problems, such as blood vessel damage and breathing problems.
The pandemic claimed the lives of more people working in healthcare than in any other sector.
Carolina Cáceres is on her way to a demonstration in downtown Buenos Aires. Even before the pandemic, she belonged to a union and serves as General Secretary of the Association of Nurses. Argentina is a football-crazy nation. And today, a match has been organised to help raise awareness of the plight of healthcare workers. The nurses are playing a team from the mayor's office.
As a certified nurse, I've been working for 16 years in a public hospital in the city and earned no more than 100,000 pesos.
That's the equivalent of 600 euros.
It's outrageous. Politicians don't mind us earning half of what everyone else in healthcare earns.
Nurses in Argentina were also applauded from balconies during the lockdown.
At the start, we all cheered them on, and then it was over. I support them.
I was in hospital for 6 months in 2021. I had COVID, and it was pretty serious. And I'm so thankful to everyone in the health service.
Cáceres finds the inspiration for her work in caring for her patients.
Nursing has that closeness, the ability to really help a patient at the most difficult moment.
In the match, the nurses won against the politicians, but their salaries remain as low as ever.
Noé Trejo in Mexico has also struggled with financial hardship. The Uber driver could not have provided for his family without delving into his savings. Our reporter Heitor Saez met him.
I'm Noé Trejo from Mexico City, and I had COVID-19. The first time I had it was in March 2020, and the second time in December 2021. I noticed I'd contracted it because I couldn't taste or smell anything. The doctor didn't know how to treat us. He cared for us as if we had a bad flu. He knew we had COVID, but didn't want to scare us. The pandemic was just starting at that point, and he wanted to protect us so that we didn't develop any trauma. When I got infected for the second time, a year ago, I was in a bad way. I'd already been vaccinated. I had to stay in bed for 3 days. Our relationship became a little more argumentative, and we had to give each other more room. We're a 4-person family, and we each need our space. You go mad living together in a small space. I was on standby for Uber every day. Even though we had no customers, business was really slow. For the first 3 months of the pandemic, I had to feed my family out of my savings. After those first 3 months, companies got going again and wanted their employees to be driven to work so they had more protection. Since then, the Uber service has stabilized again and has remained consistent until today. It was good for us because there was hardly any traffic.
Y a la fecha no ha bajado. De hecho, nos iba bien porque no había tráfico. Hola, buenas tardes.
Buenas tardes.
Bienvenida. Mi nombre es Noé.
I was listening to the radio and was horrified when I heard the news. It was my job to transport people through the pandemic. I put out plastic to protect myself from my passengers. I kept antibacterial gel in the car. If I was paid in cash, I tried to disinfect it.
Cada vez que tomo efectivo trato de desinfectarlo. El gobierno mexicano.
The Mexican government didn't want to mandate a lockdown at first. They didn't want to ban anything. The truth is, we needed more restrictions during the second wave, when many people died, because the second wave was awful.
Una temporada de COVID de la segunda oleada que sí estuvo pues fatal.
I have damage to my lungs. It puts a strain on me at work and sometimes makes it difficult to breathe.
Treating the dangerous long-term consequences of a COVID infection is a challenge worldwide. Johan Ramirez met a long COVID sufferer in Quito, the capital of Ecuador.
Esteban Ron had COVID-19 back in 2020. 2 years later, he's still having his blood tested every 2 months. The initial infection left him bedbound for 11 days, but it wasn't until later that things got really bad. He started suffering from headaches, fatigue, shortness of breath, dizziness, and overall weakness.
My life has changed completely. I've had to alter my diet for starters. I'm now very strict about particular foods. I can't eat any fats, and I certainly can't drink too much alcohol. Sport used to be a central part of my life. I used to exercise almost every day, but now I can only exercise 2 or 3 times a week. I'm just too weak. I have to do it in small amounts, otherwise my body can't cope.
On top of these physical effects and limitations on his life, there's also the financial impact. So far, his treatment has cost more than $18,000 US. And he is one of the lucky ones. As a university professor, he has private health insurance which covers the costs. Blood transfusions are particularly expensive. So far, he has had 14 of them.
The transfusions are not just about blood. They include a special hematological component that I receive, which enables my body to react better. The transfusions reduce my tiredness. They help me breathe more easily. They enable me to lead a normal life and have time for my work and my family. Without them, I would have to keep taking breaks and having naps to help me relax and recover. But each transfusion costs between $1,200 and $1,300 US.
Ecuador was severely affected by the pandemic. Despite months of strict lockdowns, the virus continued to spread, and the country's health system was brought to its knees. Hundreds of people here are still suffering after effects from the illness, despite no longer testing positive for it. In 10 of the country's 24 federal states, the government has now set up centers offering aftercare for COVID-19 patients.
We decided to specially train some of our medical professionals, mainly specialists in pulmonary rehabilitation, to be able to deal with the various lung problems that occur, so that they can recognize them and help treat them, using specific exercises for reactivating lung capacity. This is for patients who have had COVID once or multiple times.
Esteban Ron has another doctor's appointment. He comes here for a checkup once a month.
How are you doing?
Good. I'm doing much better than I was.
Today's blood test is the first one without signs of anemia. We see a normal hemoglobin value of 15.6. A check of your iron levels reveals that your serum iron is normal. Your iron deposits are low, though, so the hematologist may decide to give you another transfusion to top them up.
For Esteban Ron, there's light at the end of the tunnel. He can cycle through Quito, and he hopes that one day he'll be back to his previous fitness levels.
One of the unsettling characteristics of long COVID is that there are no biomarkers to enable a clear medical diagnosis. That's where our four-legged friends could come to the rescue. Researchers in Hanover have discovered that specially trained sniffer dogs can detect a long COVID infection.
This is Berlin, and this is Polly. Like all dogs, they have an incredibly sensitive sense of smell. Researchers at the University of Veterinary Medicine Hanover are training the two dogs and a dozen others as part of a study on diagnosing long COVID. With training, the dogs are usually able to correctly identify smell samples from infected patients.
The accuracy rate is surprisingly high. That was also such a eureka moment for us when we began the study. Globally, the accuracy rate of dogs is 81 to 86%. The dogs are much better than rapid antigen tests.
So how do dogs detect COVID infections? Anyone who has contracted the virus emits volatile organic compounds. The dogs can sniff these out, and apparently even long after a patient has recovered.
We actually found out that the dogs were able to identify long COVID samples, but only when they were presented alongside negative samples. When presented next to samples of acute COVID, the dogs preferred the acute samples. So we concluded that there is some kind of degrading odor profile, and we're trying to confirm that in further studies. These are the inner workings of our machine.
Behind each sniffing hole is a slot with two samples, one with the COVID-19 virus and one without. The machine was designed to train dogs in the detection of drugs and explosives. But researchers found that it can also be used with COVID samples.
After each run, all the slides are repositioned so that only one hole contains a positive sample. All other holes contain negative samples. If the dog keeps its nose in the hole with the positive sample for long enough, then a feeding mechanism is triggered.
In a secure laboratory at the university, a virologist prepares the COVID samples. Saliva, sweat and urine specimens are used in the training. So that they are no longer infectious, the samples are chemically treated beforehand.
We have to deactivate the samples because dogs, and of course the people who train the dogs, could otherwise get infected.
Hi, Claudia.
Now the samples are no longer infectious and can be used for training. In 2020, scientists conducted the first tests with the specimens and discovered that sniffer dogs can indeed detect COVID-19. But could sniffer dogs also be used in everyday medical practice?
Ja, das ist denkbar.
Yes, it's feasible, because the dogs really do it very quickly. There are ways to train them. There are training programs, not so much for disease detection at the moment. It's mainly training to detect explosives or drugs. But you can also transfer the expertise to disease detection.
Oder der Erkrankungsdetektion.
The researchers in Hanover will present their results next year. The World Health Organization is now also recognizing the potential for using the animals' sensitive noses to detect illness. It wants to support the scientists and their canine assistants into the future.
Coming up on the next COVID-19 special, join us at a Christmas market in Berlin. Now, after 2 years, vendors are finally able to serve the public again. Until then, bye-bye and stay healthy.